Okay everyone, now that we have covered what diabetes is and the negative outcomes that can happen if you don't manage it properly, I would like to discuss some personal characteristics and habits that can put you at a greater risk for those negative outcomes. So we have these information sheets here. They're being passed around the circle and I would like everyone to take one. And this is going to act as an outline for our group discussion. Now, before we get into the group discussion, I would like to give you guys just a brief overview of these, and then we'll jump right into it. So the point of this discussion is for you guys to recognize which of these risk factors applies to you personally, so that in the next part of our session, where we talk about how to manage these risk factors, you can choose the interventions that will reduce your personal risk the most. Okay, so let's get started. In this red bubble here, we have obesity. And obesity is defined as a body mass index of 30 or greater, and this contributes to insulin resistance in the body cells, which will worsen your diabetes symptoms. And I don't want you guys to worry too much about what your BMI is. I'm more concerned with whether you consider yourself to be a healthy weight or if you feel that you're overweight and that you could benefit from weight loss. So if you think that's you, obesity applies to you. Next, we have smoking in this orange bubble here. So studies have shown that smoking is a direct cause of type 2 diabetes and many other health complications like heart disease, which you're already at risk for with diabetes. So if you are a smoker, it is in your best interest to quit or at least begin the process of quitting, and we will be discussing that in the next segment of the program. Next, in our yellow bubble here, we have an inactive lifestyle, and this contributes to obesity and decreased blood flow to extremities, especially if you're sitting at a desk all day, you're not getting that blood flow, and this can lead to nerve damage and foot ulcers and possibly amputation. And I would say that this applies to you if you're not partaking in some form of physical activity at least once a day. Next, in our green bubble here, we have high cholesterol, which is just an increased amount of bad fats in your bloodstream, which contributes to high blood pressure, and these fats can build up on the blood vessels, putting more strain on the heart. And this is hard to determine without getting blood work, so unless you already have this diagnosis, you wouldn't know, but I do recommend that everyone pay a visit to their family doctor just to confirm, because this is something you want to be aware of. Next, in our blue bubble here, we have unhealthy diet, which plays a role in high cholesterol and obesity, and it makes you more susceptible to the complications of those risk factors. So if you get fast food multiple times a week, instead of cooking your own meals, if you're rarely including fruits and vegetables in your meals, if you consume a lot of salty or fatty foods and sugary drinks, that applies to you. In our purple bubble here, we have stress. And stress causes increased inflammation in the body, and that's been associated with increased blood pressure, again putting strain on the heart and blood vessels in various parts of the body. So if you feel stress at least once every day, this risk factor applies to you, and you'll want to focus on ways to reduce that stress in the next section. And lastly, in our pink bubble here, we've got hypertension, which puts you at risk for all of the negative outcomes we talked about. So this affects the kidneys, it affects the heart, puts you at a risk for stroke, it damages blood vessels in the eyes, so causes vision problems and nerve damage. And again, this is hard to determine, like high cholesterol, without a previous diagnosis. So when you visit your family doctor, that can help you clarify whether you have this or not. So now that we know what all of those look like, let's go around the circle, and I want everyone to list the factors that they think applies to them. And if you'd like, you can elaborate a bit more on why you think you have these risk factors and what in your life contributed to you having these risk factors. All right, so why don't we start with you, Andy? Okay, thank you, Rachel. So has everyone had a chance to talk now? Everyone's gone? Okay, great. So let's just sum up here real quick. The risk factors we talked about were obesity, smoking, inactive lifestyle, high cholesterol, unhealthy diet, stress, and hypertension. Those are all in the sheet that I gave you. And so now that you know which of these applies to you, we can move on to the next section where we're going to talk about how to manage each of these, and you guys can now prioritize which interventions you're going to use. Good job, everyone.